Assalamualaikum and good day. Today I would like to present my research entitled The Effects of SSKR and Care Bundle on Nurses' Practice in Prevention of Pressure Ulcer. Before I proceed to my presentation, let me introduce myself first. I am Norasma binti Bakar, a nursing lecturer in Faculty of Health Science at UiTM, Cawangan Pulau Pinang campus, Batam. My expertise in critical care and women health. Here is my content outlines. The introduction. Pressure ulcer is defined by localized damage to the skin and underlying soft tissue. The damage or injury of skin is usually over the body prominent. The prevalence was high among obesity patients and all ages. The classification of pressure ulcer. We have 4 stages of classification of pressure ulcer. Stage 1, non-vulnerable erythema of intact skin. Stage 2, partial thickness skin loss with exposed dermis. Stage 3, full thickness skin loss. Meanwhile, stage 4 is fully thickness skin and tissue loss. SSKR and Care Bundle is a set of straightforward practice, simple intervention that when combined lead to positive patient outcome. S for surface, S for skin, K for keep your patient moving, I for incontinence or moisture, N for nutrition or hydration. Pressure ulcers are common in acute and long-term care. However, critically ill patients usually have multiple risk factors for pressure ulcer. It will remain a major healthcare problem around the world. Pressure ulcer statistics among patients in critical care unit in Malaysia include incidence of pressure ulcer range between 0.5 to 21.1 per thousand patients per day, which means of 6.6 per thousand patients a day. Pressure ulcer among the critically ill patients. ICU or intensive care unit patients are a high risk of pressure ulcers development. Patients with pressure ulcer experience significantly increased morbidity, mortality, and financial burden. So, nurses practice on pressure ulcers prevention. A major barrier that pursues nurses is practice pressure ulcer prevention are identified with the notable ones being a heavy workload or inadequate staff, shortage or resource, and inadequate training about pressure ulcer prevention. Research objective. For the general objective, it is to determine practice of nurses pre and post teaching session in using SSKR and Care Bundle. For the specific objective, to compare nurses practice score pre and post teaching session in using SSKR and Care Bundle. The methodology. We use quasi-experimental pre and post test setting at ICU, which is our population is nurses working in intensive care unit, using self-administration questionnaire as instrumental, and the intervention program is lecturer and hand. The result. Demographic data. Majority of nurses, 46.7%, were less than 13 years old. 46.4% having experienced less than 5 years in working area. 85% having formal training in pressure ulcer prevention. Nurses practice on prevention of pressure ulcer before implementation of SSKR and Care Bundle. We were assessing each dimension of the practice regarding pressure ulcer prevention before implementation of SSKR and Care Bundle and education program. The result shows nurses in both groups always practice in pressure ulcer prevention, but nurses not pay attention to pressure ulcer point, 3.3%. Nurses' practice on prevention of pressure ulcer after implementation of SSKR and care bundle. We were assessing each dimension of practice regarding pressure ulcer prevention after implementation of SSKR and care bundle. The results show increasing the level of practice in prevention of pressure ulcer among ICU patients, especially in skin assessment and monitor a protein and calorie diet. Discussion and recommendation regarding social demographic characteristics of nurses. Findings of this study indicate that majority of nurses, 46.7% in both groups, aged less than 13 years old. This might be due to almost of nurses were newly graduated from College of Nursing and working together at intensive care unit. Meanwhile, the age of nurses range between 31 to 14 years old is below than 40%, in compromise with the finding by Islam, who study nurses' knowledge, attitude and practice regarding pressure ulcer prevention for hospitalized patients at Rajshahi Medical College Hospital in Bangladesh revealed that the age range is almost nurses was between 13 to 14 years old. It is 56%. Nurses' practice regarding pressure ulcer prevention. The study result found that was nurses mostly practice preventing pressure ulcers, but the result in attending seminars to pressure ulcer 53.3% and give advice to the patient or caregiver regarding prevention of pressure ulcer is unsatisfactory. The results similarly before and after implementation of SSKR and care bundle program, in compromise with study done by Taha, who revealed that the majority of nurses who practice in the study had unsatisfactory practice level regarding the pressure ulcer management. Recommendation for nursing administration. Develop hospital policy and guideline. Identify the perceived barrier of care. The result of this study should be shared among staff. Nursing education in-service training and refresher course. A training program on pressure ulcer prevention should also be conducted for nursing leaders and to nurses in general ward. Nursing research. Further intervention studies should be done for patients, especially in critical care unit. Replication study is recommended in other settings to promote the generalizability of the findings above. It can be concluded from this study that the design SSKR and care bundle protocol should be beneficial in improving the practice of the critical care nurses working in critical care unit as well on patients' outcome in relation to prevention of pressure ulcer at the intensive care units. Critical care nurses have the unique challenge of identifying the appropriate intervention to prevent pressure ulcer development and ensuring that they are knowledgeable about the manufacturer recommendation for device use in the care of the patient. Last but not least, the healthy skin of patients in critical care starts with you, nurses. That's all. Thank you for your attention.